Hello, in this video I'm going to be talking about double mastectomy. Who is it for? What does it offer to people? And then some common misconceptions. Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. So what is a double mastectomy? A double mastectomy refers to the removal of both breasts. When this is done for prevention on one side after cancer on the other, this is referred to as a contralateral, meaning the other side, prophylactic, meaning preventative mastectomy. Some people will also have a double mastectomy without any history of cancer at all. And then for some people, they have cancer in both breasts, in which case the mastectomy on both sides is therapeutic. So just to recap, people can have a double mastectomy because there's cancer in both breasts, and a mastectomy is the preferred surgical option. The second reason is because they have a therapeutic mastectomy on the side of the cancer and a contralateral prophylactic mastectomy. And then there are some people who have a prophylactic double mastectomy, prophylactic referring to prevention. So who is a double mastectomy for? A double mastectomy will be appropriate in people who have an inherited susceptibility to breast cancer, such as a BRCA1 or 2 mutation. A couple other mutations are up here on the screen as well. And for those people, having a double mastectomy in the preventative setting can decrease the risk of breast cancer by up to 95%. For people who have a cancer in one breast, there are reasons that they may wish to have a mastectomy on the other breast, either at the same time or in the same time period. And that is because radiation therapy may not be prudent in their case for a variety of reasons. That might be somebody who has previous radiation therapy, for example. There are also people who are unable to have a cosmetically appealing result when they have a mastectomy on one side with reconstruction. It can be hard for some people to have enough tissue to have a symmetric breast. And so let's say somebody's having a mastectomy on one side. That's the best surgical option for them with reconstruction. Sometimes it's difficult for them to have a symmetric breast compared to the non-affected breast. Bilateral mastectomy with either reconstruction or no reconstruction gives them the best cosmetic outcome. And then there are some people in whom a bilateral mastectomy is the thing that they need to be able to feel that they've done everything possible to decrease the risk of the cancer coming back. And those are mastectomies we refer to as having been done for peace of mind. I'll be getting to some facts about what does a double mastectomy do for you in just a moment. What does a double mastectomy involve? Well, some of what it involves depends on whether or not the lymph nodes are removed from both sides. So if somebody's having a mastectomy with no lymph node removal and they decide to have both breasts removed, a double mastectomy, and that side also doesn't need lymph nodes to be done, the surgical procedure is going to be different from somebody who has lymph nodes looked at on one side and not the other, or lymph nodes looked at on both sides. So a lot of times it's important to separate the surgery on the breast from the surgery on the lymph nodes in terms of what to expect, preoperative workup and evaluation, and recovery time. In somebody who has a double mastectomy with no reconstruction and no lymph node involvement, the recovery generally will involve drains, placed to drain any fluid, but not always. And after that, wound care for both sides. So surgical wound care, dressings will be changed, and pain management will be done. It doesn't necessarily double the pain to have a double mastectomy, but it is more involved. It's a longer surgical procedure. You're under anesthesia for longer, and so you should expect that recovery will take longer than for somebody who has a single mastectomy. If the lymph nodes are looked at, a drain will often be placed to drain any fluid that accumulates, and the mobility restrictions, when you can start to move your arms around and become more mobile, will be a little different if the lymph nodes have been operated on as well. What if you have reconstruction? If you have reconstruction with an implant or with your own tissue, and we have lots of videos about reconstructive surgery, surgery recovery will often take longer if you use your own tissue, because now you have an incision at the donor site, whether it's the belly or the back or the glute, your backside. And so now you have two incisions, and these are longer procedures as well. So the recovery time depends on what's done, how long you're in the operating room, how many incisions you have, as well as whether or not your mobility needs to be limited in your upper extremities, in the arms. And that in turn depends on whether or not the lymph nodes are operated on as well. What about complications? Well, after any surgery, there's a risk of infection. And so when one has more incisions, the risk of infection is higher. Now, the side that's had surgery for cancer, let's say you're having surgery for cancer on one side and prophylactic contralateral mastectomy on the other, those two incisions are equally likely to have complications. There isn't one side that's more likely than another, but having two breasts removed will increase the risk of infection. Not a lot, but enough that it's worth mentioning. After a mastectomy, unilateral or bilateral, there are physical effects, not just the risks like infection, but also the pain. Some people are able to manage that without heavy medications. In fact, we try to give as few medications as possible so that you are as alert and feeling as much like yourself as possible. But it's important that your pain be managed effectively. There's tightness after surgery, fluid can collect. You may notice that the skin looks a little bumpy because the healing process is still taking place. It can take 6 to 12 months for that mastectomy incision to look the way it will long term, so be really patient. You can have changes made after a mastectomy if there's extra tissue on one side or if there's a little redundant or extra tissue over near the arm, but surgeons like to wait a few months so that we can see the effects of the normal healing process. There is, of course, the emotional impact of a bilateral mastectomy. There's an emotional impact for any breast surgery, any breast cancer. But after a bilateral mastectomy, people describe grief and confusion and body image issues related to, for women, their femininity, and for anybody, the impact of having an incision or scar across their chest. Now, I don't want to say that this is a reason not to have this done. Many people who've had a bilateral mastectomy make perfect peace with the physical effects and the emotional and psychological and body image effects as well. These decisions are highly personalized. If you take nothing else away from the video, that's what I want you to hear, that these decisions and your experience are deeply personal to you. And what another person describes going through this will be very different from your own experience. It's important that your experience be validated and that you be confident in the decisions that you make. If you're wondering about whether a double mastectomy is the best treatment choice for you and the pros and cons of a double mastectomy versus other types of surgery, I want to invite you to go to Yerbba.com. Yerbba.com will create your personalized Yerbba report by taking everything we know about your cancer and your history, either after you grant us permission to access your reports or after you upload your reports. It shows you all the treatment options you might hear about when you go see the different doctors involved in your care, the pros and cons of each. It gives you a set of questions that you can take to ask your doctors, and it gives you evidence-based, up-to-date information that's personalized for you. Let's talk about some misconceptions with bilateral mastectomy. It is very common for people to think, I want to do everything possible. I want to keep the cancer from coming back. Therefore, I'm going to have both breasts removed, even if I don't have to. It's a natural thought. What the research has shown, however, is that bilateral mastectomy does not improve breast cancer survival. We have many studies showing this. One in particular is by Todd Tuttle, a surgeon, published in 2017, showing people who elected to have bilateral mastectomy when it was a choice had no better survival than people who had a unilateral mastectomy or other incision on the breast. Why is that? Well, the important thing to know is it doesn't help to remove more normal breast tissue. So when we're talking about more breast surgery than is done to remove the primary tumor and a surrounding area of normal tissue, there is no advantage in terms of survival or other outcome in terms of taking more normal breast tissue. And in terms of survival, breast cancer survival is affected by disease that spreads to other parts of the body, and surgery doesn't affect that. What does affect cancer and decreasing the likelihood of it spread to other parts of the body are other therapies. So specifically radiation therapy, but even more important, systemic therapy. So endocrine therapy, targeted therapy, and chemotherapy. It is a common misconception that a double mastectomy will increase my chance of cure, and the bottom line is it won't. It's all your treatment put together that's going to give you the best chance. I've covered a lot in this video. I hope it's been helpful. Thank you for watching, and we'll see you next time.